Welcome back. You're still watching Network Africa on Channels Television. A reminder of the news which we just have coming in. Now, we've got updates from the lower chamber where it appears that the tension over the leadership of the House of Representatives may have come to a momentary end as the Speaker announced the principal officers today. Honorable Femi Gbajambiamila is the majority leader. That's a signal that the different factions may have close ranks on the matter. Earlier on, the Dogara group have argued that the majority leader should not come from the southwest and the northeast zones, considering the fact that the two zones produce the speaker and the deputy speaker positions. We're still looking at developments at home, and unfortunately there's bad news from the northeastern part of Nigeria. At least 25 people have been killed by suspected Boko Haram Islamist militants in raids on Monday afternoon and Tuesday morning on 3 communities in Nigeria's northeastern Borno state. Fighters in a pickup truck attacked the town of Dile and 2 smaller communities in the Askira Uba area of Borno state. We understand that vigilantes resisted the attack on Dile that came around 1 p.m. local time. The Borno State Governor Kashim Shettima explained that in the month of July alone, 7 local government areas out of 27 were largely inaccessible because Boko Haram sect members are still a huge force to be reckoned with in those parts. Statistics show that since May the 29th, more than 600 people have been killed in Nigeria alone. And if you want to look at that from a regional perspective, which includes countries like Chad, then we're looking at about 800 deaths and counting. Well, today is July the 28th. It's World Hepatitis Day. On a global scale, we understand that 400 million people are living with hepatitis B or C. Those figures are found from the worldhepatitisday.org. This virus is no joking matter, as every year 1.4 million people die from viral hepatitis, and the sad part is that all of these deaths could have been prevented. And that's with better awareness and understanding of how we can prevent hepatitis. The World Health Organization says we can eliminate this disease and save as many as 4,000 lives a day. Well, we'll be bringing you more facts about hepatitis, but we're joined in studio right now by Dr. Fumi Leshi, who is a consultant hepatologist and also an associate professor of medicine. Dr. Leshi, thank you very much for making our time to be with us today.
Thank you very much, Cynthia. I'm very pleased to be here.
Thank you very much. Now, I'd just like to ask you, how common is hepatitis, especially in Nigeria?
Hepatitis in Nigeria is thought to occur in 1 in every 10 person. I think that's pretty common. It's thought to occur in 13% of people, of the general population, and it's definitely more common than HIV. I mean, the prevalence of HIV is like 4.5% compared to 13.5% of hepatitis B.
More common than the HIV?
Absolutely.
That's alarming. Now, based on the figures we saw from worldhepatitisday.org, we understand that there are 1.4 million deaths caused by hepatitis annually.
Yes.
Do you think most of the figures come from the African continent?
1/3 of these figures come from the African continent. And these deaths sometimes are not recognized because the patients may die of liver disease, what we call liver cirrhosis, or they may die of liver cancer, apart from the infection itself. So the infection can cause these diseases. You said 1.4 million. It's the same figure for HIV deaths. It's comparable to tuberculosis deaths. It's comparable to malaria deaths. Yet so little is being said about hepatitis worldwide. So I'm very happy that on a day like this, which is World Hepatitis Day, we are recognizing the scourge of hepatitis B and all the other viruses and raising awareness about the virus.
But why has the awareness been on a low scale all this while if it's as intense as we now know it to be?
That's a very great question, and there are many reasons for that. One is that it's a complicated infection, and the disease has multiple phases. So not all the phases are being captured as we count how many patients are infected with hepatitis B. For instance, liver cancer. Very few people would relate hepatitis and liver cancer, or they would not relate hepatitis and liver cirrhosis. In parts of the world, the vaccine for hepatitis B has been available for the past 35 years. And in Western countries, hepatitis B prevalence is very low. In the USA, in the UK, maybe 1% of the population will have hepatitis B. And that 1%, I bet you they are from Nigeria, or they're from Africa or Southeast Asia. They are immigrant populations. So hepatitis B has been controlled. It is a curable disease. And the question is, why are we not all vaccinated?
So why are we not all vaccinated?
Good question. Vaccination has been expensive in developing countries, in low, middle-income countries. At the last count, the vaccination was like $0.5 per dose, and everyone requires 3 doses. Now, for childhood vaccination, the other infections have cheaper vaccines. So the hepatitis B vaccine has been a bit more expensive, and the coverage is not very high. In Nigeria, it's less than 50%. In many parts of sub-Saharan Africa, it varies between 30% to 70%. So I guess the international drive to control hepatitis B is not there, as it was for HIV. But I'm happy now that since 2010, the World Health Organization has risen up to the challenge, and they want a situation where viral hepatitis, both B and C, is globally controlled.
Now, let's talk about the stigma.
Right.
Because I was going to talk about the facts later on, but we know that based on what we have here, we're seeing that it can be tremendous,
yes,
and also very detrimental.
Absolutely. I am glad at that question, because most people have erroneous information about the transmission of hepatitis B. When we talk to patients who have hepatitis B, they are hiding. They feel that there's a lot of discrimination. They lose their families. They lose their jobs because people do not understand what hepatitis B or C is or where it came from. And one of the messages of today is to know the risks for hepatitis B. We know that it is a virus that is in the blood, that eats up the liver. We do know that it is spread by blood or bodily fluids. But many people do not realize that 70% of these infections are transmitted from child to child. So that is before age 5, patients have hepatitis B, or else is mother to child, or even what we call unsafe injections. What do I mean by unsafe injections? I mean that needles, sharps, blades that are reused, all right, or that they are poorly sterilized. The World Health Organization estimates that half of the 4 million new infections are due to unsafe injections. And we are all guilty of unsafe injections. Sometimes in the hospitals, in those days, needles were reused, you know. In our cultural practices, all right, our scarification marks, tattoos, you know, yes, private and public health practices, there's a lot of unsafe injections. So the message is we need to demand safe injections to stop new infections from occurring.
Well, Dr. Leshi, really thank you very much for educating us in such a short space of time. I've learned so much. Thank you very much. We'll be posting those facts that we plan to tell you later on our Twitter page, and you can look at that later on after the show. But here is our question of the day, which is what Dr. Leshi was talking about. How can stigma against people living with hepatitis be reduced? Feel free to reach out to us either via email or Twitter. The address and handle are right there on your screen. As always, it's been a pleasure. Thank you so much for joining us on Network Africa. I'm Cynthia Are.